Good morning, everyone. I'm Jay Watson with Emory Brain Health Center, and I'm joined this morning by pandemic expert Dr. Carlos Del Rio, who's the Executive Associate Dean of Emory University School of Medicine at Grady Health System and Professor of Medicine, Global Health, and Epidemiology. Dr. Del Rio, wonderful to see you as always.
Good to see you, Jay.
Let's start off with a broad question, if you don't mind. How are we doing in Georgia?
Well, we are going through a significant increase in cases. We are up to 173,000 cases, and the first wave in March, April was, people call it a wave. This is not a wave. This is more like a tsunami. But it appears that cases, at least the increase in the number of cases, is beginning to slow down. We still need to come down, and we will be coming down from a very high peak. So I'm worried that that hospitalizations and deaths are going to continue to rise, even though cases may not be rising as fast, just because we are really coming from a very, very high peak. There's a lot of transmission still happening, about 38 cases per 100,000 population. You would like to see that below 10 per 100,000 population. So the fact that we are 3 times where we should be is not good.
When you use the word tsunami, I saw a national interview you did where you had some numbers to go with that, referring to Wuhan. Could you talk about that?
Well, I think about the United States, and throughout the entire COVID epidemic, the city of Wuhan, where this started, had 70,000 cases, around 70,000 cases. Currently in the U.S., we're having 70,000 cases plus every day. So we're basically, as a country, having a Wuhan each day. The epidemic in the U.S. is out of control. We really have a forest fire happening, and we don't really have a national strategy. I'm very, very concerned about the country, and I'm very concerned that we simply are not taking this epidemic seriously, and we're not doing what we need to be doing as a country. You can't really fight an epidemic with 50 different fronts, and that's what we're doing right now.
So one of our questions that came in today refers to you have been talking about a federal mask mandate, and the question is, do you really think this would stop it?
Well, we are at a point right now that nothing is going to immediately stop it. It's going to take some time. I think we need several things implemented. We need a mask mandate. We also need, masks don't substitute for social distancing, right? We need to remember that the 3 things that are key are the 3 W's: wash your hands, watch your distance, and wear a mask. And we need those 3 things implemented. If we did that well and we did it consistently, we would significantly decrease transmission of this virus. Different models show that if 70, 80% plus of the population uses a face mask, within probably 8 weeks or so, we can probably slow the transmission to a level that it will be very feasible to do many things that we want to do, like opening schools, like opening sports, like doing all those things that currently simply are not possible.
How do I know if I'm a candidate for the Moderna phase 3 trial in Atlanta? Can Dr. Rio talk about what's going on with that?
So let's talk a little bit about vaccines. I think we all realize that a vaccine is going to be critical in order to get out of this epidemic. And I'm really thrilled just amazed about how quickly the field has moved in developing vaccines. And we have several vaccine candidates, of which approximately 5 are currently now entering the last phase of development, which is called the phase 3 clinical trials. The first one here in the U.S. to enter phase 3 clinical trials is the vaccine developed by Moderna Pharmaceuticals. And we at Emory were part of the phase 1 part of that study, and now we're going to be part of the phase 3 study. The phase 3 study is going to take 30,000 volunteers at 89 clinical research sites throughout the country, and it's going to give 15,000 of them the vaccine and 15,000 of them placebo, and then it's going to follow them. And it's going to follow them to see if they get infected and if they get sick. So you need to go to a place called clinicaltrials.gov and look at this trial, and it will tell you whether you're a candidate or not. And we're looking for a broad representation. We want to include, people from different races, different ethnicities, different ages, and different risks, right? We need to get people that are going to be really at highest risk of getting infected in order to see if the vaccine works or not.
Are we still possibly looking at a timeline of early 2021 for having a vaccine?
I think if everything goes well, it will be in early next year, January, March, early 21, that we will be ready to start thinking about 1 or more vaccines being out there. But then we need to roll them out. And the logistics of rolling out the vaccine are not simple. And, vaccinating millions of people is not going to be simple. So in reality, I would say that, yeah, sometime next summer, we could be all talking about, have you gotten the vaccine? Yes, not. What are you going to do? And then we need to vaccinate at least 60% of the country to get the level of protection that we need.
You've probably seen about the Florida Marlins baseball team having a big COVID outbreak. What about our kids who are playing baseball right now in Atlanta? And does this give us a sign of what could happen when we send them back to school?
Well, again, I go back to the risk and what you need to avoid. And we don't know how the players and the Marlins got infected. I think at least I'm not aware. I need to, need to see what the data is. I suspect they either got infected in the clubhouse, or they got infected going to a party or going out together. So frequently it's not what we do in school or in sports, but what we do outside, right? And I think when I think about the clubhouse, I think about the things that facilitate transmission of this virus. And one of them is close contact with somebody for a long period of time, 10, 15 minutes. The second one is close quarters. So like a clubhouse would be ideal, poor ventilation, no windows, lots of people. And the third one is crowding. Again, a clubhouse will do that. So it may not be the baseball, but it may be, the clubhouse. It may be going out for dinner. It may be some other reason why they got infected. I think it's telling us something about how this virus is easily transmissible among people.
This question is in the same vein. It just came through. Major college football programs are moving forward with playing this fall. What are your thoughts? How can they do this successfully and have fans in the stands?
Well, again, I think currently we have too much virus in the community to do any of this thing successfully. And it's not because of football. It's because we have too many infected people out there. We have to bring the amount of infection down. And, I'm part of the advisory committee that is working with the NCAA. And I would tell you that if you look at the internet and you look at the graph that the NCAA put out there, we were making plans providing that a graph was going to take us down to a low number of cases today. We weren't planning for this tsunami. So the situation right now is very different than what it was when we were making plans. I think at this point in time, we need to focus on bringing cases down, because no matter what you do, you're going to see infections out there. There's way too much, virus in the community. So if you want to see college football, if you want to see sports this fall, start wearing your mask now.
Mm-hmm. This next question is about flu shots. When should people get them? How important is it to get this year? Is it worth the risk of getting COVID-19 by going to a pharmacy to get one, or for a company to offer it to those who are working in the building?
Get your flu shot. I will get my flu shot somewhere in late September, early October. Get your flu shot. Go to the CVS, go to the Walgreens, go to your grocery store, go to your doctor wearing your mask. They're going to be wearing masks. You're going to be fine. You're not going to be at risk of COVID by getting your flu shot. Get your flu shot. If your company has them, great, but get your flu shot.
Are we looking at a double whammy because of COVID and the flu out there at the same time come this fall?
Many people are thinking of that double whammy, but on the opposite end of that, I would tell you that all the things we're doing to stop COVID also stop flu transmission. So in fact, if we do things well, we will not have either COVID or flu. Now, if we don't take things seriously and we're all out there not wearing a mask and not socially distancing, we will have both of them, and it's going to be a mess.
This next question is about pooling, and I'm going to have you explain what that is to folks. But the question is, the FDA has issued authorization to Quest Diagnostics for pooled samples when testing. What are your thoughts about pooling, and how will it affect testing? So first off, tell us what pooling is.
Okay, so pooling is the following. Let's say I have 5 people and we test 5 people. So we take a swab, put in the nose, get swabs from 5 different individuals. And then what we do is we put the 5 of them into one container and we mix them. So now we have the samples of the potential samples of 5 individuals. And then we run one test. Now, if that one test is negative, that means that all 5 people are negative. But of course, if that test is positive, then I need to break down the pool, and I need to test every individual independently to find out who of the 5 is the one that is infected. If you're in a situation of low prevalence, pooling makes a lot of sense. So in other words, if you are under 5% prevalence of infection, then let's suppose we have incoming college students, and they may have a 2 or a 3% prevalence. So instead of testing every student independently, you can pool, and therefore you can be much more efficient in doing the testing. That's what you gain. You gain efficiency.
Let's talk about COVID and pregnancy. What do we know about the risk to the mother and the baby?
So we're still learning, but I think what we know today is that COVID is unlikely to be a problem during pregnancy. There are some cases out there. There's some reports of perinatal transmission. There are not many. They're few and the exception. There's one from France of showing some perinatal transmission. There is some evidence that if you get COVID in the third trimester of pregnancy, you're more likely to have a preterm birth, or you're more likely to get a complication. And there is the risk that if the mother gets it near the end of pregnancy, the baby can then be infected. But in general, compared to other diseases that we clearly see, for example, the flu can really be very severe in pregnancy. While we see that, and CDC has a study they published recently saying, yes, there's higher risk to pregnant women of getting complications, the rate of complications is not as high as it was for the flu or the respiratory viruses. My main advice to a pregnant woman is don't get COVID, and if you do, take care of yourself so you don't get sick.
There is a CDC study out there that states that the real infected population is 6 to 24 times the number of actual tests. Do you agree?
Well, yes, I think that the CDC study suggests that, let's suppose here in Georgia we have 173,000 cases. The real number of infected individuals is probably 6 to 10 times that. And that's because a lot of people who've been infected either are asymptomatic or didn't get tested, didn't get around to get tested. So yes, if you go around and you test people, you probably find, but you still, in places like New York, at most 15 to 20% of the population got infected. Here in Georgia, we think it's probably in the neighborhood of about 5% of the population has been infected.
Herman Cain passed away from this virus. What message would you give to public figures about their actions as role models?
Wear a mask. Please wear a mask. Herman Cain went to the President's Convention in Tulsa. He was not wearing a mask. A lot of people got infected in that convention. Wear a mask. We really need people to wear a mask. It is time to stop arguing about it. As I tell individuals, as I tell people, wearing a mask is not normal. I don't like it. I'd rather not be without a mask. But right now we're living in an emergency, and it's not what we like, is what we need to do to stop transmission of this virus. We are seeing people die, and I feel terrible for Herman Cain. I feel terrible for his family. I wish, he hadn't been infected. I wish he hadn't died, because every death, every one of those 150,000 Americans who have died from this virus is not a number. It's actually a person. It has a name, it has a face, it has a family, and we have to stop this.
Is the cell death sludge what's blocking the venous pathways? What about arteries? Feels like there should be a known treatment if so. That's a very doctor question.
Well, we know that during this disease, in severe cases, there's an inflammatory process that leads to an increase in coagulation and the formation of clots. So when people are very sick and they're in the intensive care unit, you frequently put them on anticoagulants in order to prevent them from developing clots. And the clots are related to the inflammatory state associated with this condition.
Why does Remdesivir work so well for some very sick patients? Genetics? Does sequence of other treatments first make a difference?
No, Rendezvir actually works best when it's used sort of right before the person gets really very sick. By the time you get on a ventilator, by the time you get very sick, it doesn't work as well. It works really well when you're starting to need oxygen, when you're starting to get disease, when you're starting to get severe disease. And it works. It's amazing to see how it works and how it decreases, progression of disease, et cetera. But you have to use it fairly early. Now, the problem with Rendezvir is IV. And we currently don't have anything orally that you can take for this virus, and we have nothing to use in the outpatient setting. Remdesivir is just for people hospitalized. So a lot of research is happening, including research on a medication that was developed here at Emory. There's a medication developed here at Emory, EID 2801, that is actually now in clinical trials, and it's going to be a pill. And if that works, it'll be really a major advance in developing drugs for COVID.
We have a few questions regarding this next topic, which surrounds hydroxychloroquine. But you may have heard about a video that went viral earlier this week. And one of the questions is, what is your take on the doctors that spoke at the Supreme Court last week on the use of hydroxychloroquine for prevention and cure?
I don't know those doctors, so I'm not going to comment on the doctors. I'm going to comment on the facts. I'm going to comment on the evidence. We have at least 3 randomized control trials, and the randomized control trials are the highest level of evidence out there that shows unequivocally that hydroxychloroquine does not work for the prevention or for the treatment of COVID-19. So the evidence is very clear. Hydroxychloroquine doesn't work. Now, if you go out there and say, oh, I believe it works, well, you can believe whatever you want. But the evidence is very clear. Hydroxychloroquine does not work for prevention or treatment. And that's why if you look at the treatment guidelines, both from the Infectious Disease Society of America and from the NIH, hydroxychloroquine is not part of the treatment guidelines.
I am very concerned about my son who has asthma going back to in-person school. Should I plan for him to do virtual school instead?
We've never heard of asthma being a risk factor for severe COVID, but I understand what you're saying. If you feel uncomfortable, it's better for you to have your son stay home. But I would tell you, you also need to be sure that your son doesn't go out and, go to parties and go with other people, because at the end of the day, he will get infected. It's most important that you have your son wear a mask, have your son be protected, social distance, etc. Those are the things we need to do. It's not the going to school or not going to school. This is not a binary situation.
What do you make of the availability of ICU beds in the state of Georgia? State officials have said in recent days that some parts of Georgia only have a few beds available. Should those numbers be concerning? And what can be done to expand ICU capacity?
Yes, we are all concerned about hospital and ICU capabilities. And when I think about what needs to be done is we need to decrease the number of people coming in. We need to decrease infections. You can make more ICUs. You can make more parts of the hospital ICUs. So the 3 things to worry about, one of them is space, and I think we can make more space into ICU. Another one is stuff. We can get ventilators, we can get PPE, but the third one is staff. You have to get doctors, and more importantly, you have to get ICU nurses, and those are in short supply. So you may build all the ICUs you want, you may have all the ventilators you need, but you will not have the staff you need because there simply are not enough ICU nurses or ICU doctors to take care of the patients. So at the end of the day, the staff is our biggest challenge, and you can't make doctors or nurses out of nowhere. So the reality is we have a problem. We have a problem because we simply don't have enough trained staff to take care of more people in ICUs.
What are your thoughts on the use of face shields in addition to masks?
I think it's a great idea. I would recommend that if you're going to be in a crowded condition, if you're going to be in a close environment, you wear a face shield. I have my face shield, and when I go to a place that is crowded, when I go see a patient, when I go into a patient's room, I put a face shield to see a patient, whether the patient has COVID or not, because I don't know if that person may have COVID. I haven't done the test. I put a face shield. I've yet to get infected.
Dr. Del Rio, for most of us, would you give that advice for going to the grocery store or a Costco run or?
Sure. I mean, I think I'm a big fan of face masks. I think, and of face shields. I think a face shield doesn't substitute for a face mask, but it's an additional protection. And if you put a face mask and a face shield, you're good to go.
I look after 2 small children. Their parents are planning to send the oldest one back to preschool in a few weeks. As someone who is at higher risk of getting COVID-19, what's the likelihood of the preschooler exposing me to the virus? I've heard reports that small children are much less likely to transmit the virus. What is your current understanding of small children passing on the virus to adults?
We're still learning, and we're learning a lot about small children. We're learning a lot about some evidence suggests that they may be less likely to get infected and also less likely to transmit. Other evidence is not as clear. What I would say at this point in time is I think children could potentially transmit the disease, and therefore you need to be careful. You need to, wear a face mask, watch your distance, protect yourself.
Based on the numbers, death tolls are down. Is the death rate down because of summer or because there are better ways to treat it?
It's very interesting. The deaths are up. The mortality is down. In other words, cases have increased. Deaths have not increased that much. But mortality has increased quite a bit. We are now having over 1,000 deaths a day from this disease in the United States. I mean, that is a large number of people dying every day. But part of the reason deaths have gone down is probably younger people are getting infected, and the younger people are less likely to die. Part of the reason mortality has been down is because we've gotten better at managing these patients in the hospital. So there are many reasons. I don't think we totally fully understand why death has come down. But I can tell you that we've gotten better, and clearly people coming into the hospital, we have a better way of managing patients.
The infection rate is much higher now, but is it possible that it is now a weaker strain than it was at first?
Well, actually, there's some evidence that there may be actually a sort of a more contagious strain, a stronger strain out there. What we think is happening, though, is that if more people are wearing masks, the chances of transmission are lower. So even if you get infected, if you're wearing a mask, you get infected with a much lower dose. So the dose of infections may be coming down, and that may have something to do with seeing less people getting sick and being in the ICU.
If a student shares a dorm room with 3 other students, but each have their own room, does this student have to wear a mask to bed or not? Plus, 2 of those students will have to share a bathroom. What advice can you share on how each student will protect themselves by using the bathroom they will need to share?
Well, I think, three kids in a room is a little too many, probably. I think 2 would be the number I would ask for. I would hope that the beds be at least 6 feet apart, so they're not right next to each other. So again, socially distanced. And again, using the bathroom, clean everything. You have to use, wipes. You have to use, make sure you clean stuff, and make sure after you touch, something like the water faucet, you wash your hands. I think hand washing is a critical component of avoiding this infection.
What is your response to people who believe that mortalities are overcounted?
I think actually mortality is undercounted. We have evidence on that. Myself and a colleague, Dr. Faust at Harvard, wrote a paper in JAMA Internal Medicine about this. And the fact is that deaths have been undercounted. And looking at excess mortality is probably a better indicator, because a lot of people, as a result of COVID, have died at home, or a lot of people have died of other diseases because they were not able to go to the hospital and get care because of COVID. So the COVID mortality is not just the people that died from COVID. It's the people that died because they were not being able to get care for their heart attack or for their strokes as a result of COVID being in the hospital.
Why is it harder than ever to get tested in Georgia?
Well, we have a throughput problem, right? We have too many people that need to be tested. If you have, if you're selling hamburgers and you have, 10 hamburgers, your kitchen is making 10 hamburgers a day, and all of a sudden you have 100 people wanting to eat a hamburger, you're not going to have enough. And I think that's what happens. There's simply a throughput. There's a supply and demand issue. We need to decrease this. And that's why people are recommending pool testing, because we could potentially increase. We have to get the turnaround time of our test down.
Mm-hmm.
Test turnaround is critical that it comes down. You need to be tested. If you get tested, you need your result back. Not only do you need to be able to get tested, you need your result back, ideally within 48 hours at the latest, ideally within 24 hours.
I've heard from people who've waited 13 days for their test results.
Yeah, which then becomes totally useless, right? Because by that point, you either stayed in isolation all that time, or you infected a bunch of people if you happen to be positive.
Right. We've discussed this before, but I guess it always bears talking about it more. What kind of mask do you recommend? I was just at Mayo in Rochester, and no one wore an N95. They were all wearing surgical masks.
If everybody's wearing a surgical mask, we're all protected. So we in the hospital use surgical masks, and we put surgical masks on our patients when we're walking in the hospital, when we're seeing patients that don't have COVID. But when I'm seeing somebody that I know has COVID, then I put an N95 mask. So if you go to a hospital and you don't have COVID, they're going to be seeing you with a regular mask, and they're probably also going to be putting a regular mask on you, a regular surgical mask.
I'm going to make this your last question. A segment of the population believes that COVID-19 is a controlled hoax, and the pandemic will end on November 4th after the election. How do we educate those citizens to the realities of COVID-19? I'm sorry, I know that's a very tough question to end on.
I think we continue giving education, but again, also go to the hospital, go talk to families, go talk to people that have suffered this pandemic. This is an unprecedented pandemic. We are seeing a lot of people get sick. We're seeing a lot of people die. There's a lot of pain and suffering out there. This is serious. This is real. And unfortunately, it's not going to be over November 4th. This is going to go on for several more months. We need to get prepared. We need to plan for the long range. We need to start taking this seriously. I am really very, very tired as a healthcare worker. I'm frustrated. I'm tired that people are not taking this seriously, because the reality is, if we did, we would be in a much better place today than where we are.
On a personal note, when you're out in public and see people who are not wearing masks, have you ever said anything to anyone? Or
yes, not only I have said to people not wearing masks. I've said something to people that are wearing a mask but they're not wearing it correctly. They have the mask but it's not covering their nose, or they have a mask and they have it hanging out of the ear. You have to tell, and you have to be firm. You have to be direct, and you have to be clear. I wear a mask to protect you. You need to wear a mask to protect me. And that has to be the message. This is a message of solidarity. This is a message of caring for other people. If I care for you, I wear a mask. If you care for me, you wear a mask. If we all care for each other, and again, we as a community are a very caring community. We need to stop thinking about ourselves and start thinking about how can we end this pandemic. And if we all work together, we can do it. I'm an optimist. I believe we can do it. I strongly believe we can do it, but we have to all put our effort. And it's not easy, but it's doable.
Dr. Del Rio, thank you. I appreciate you taking all these questions as always, and I hope that we get to see you again soon and take more questions from the public as hopefully more people begin wearing masks and maybe get those numbers down a little bit.
That would be great. I would really be happy if we do that. I want to go back to my regular job.
Me too. I think everyone does. All right, be well. I'll see you.
Take care. Bye.
Take care, everyone. Bye-bye.